About 30, 40 years ago, my mom got hurt at work. She fell off a ladder, fell on her back, ruptured her low back. Watching her go through rehab, watching her to go through failed procedures and surgeries, most prominent being 30 minutes being out of surgery right before the '89 earthquake. On our way to go see her, they just wheeled her out. Noticing that what could have happened 30 minutes prior had the surgeon had his hands in her back while the earthquake was going on. Realized this has got to be a better way to do this because things have gone sideways really quickly. And watching her go through rehab and watching her go through recovery and not be able to help her at all. Really just kind of guided and ventured at what ways could I do to help somebody like my mom who had a horrible injury, not her fault, horrible injury, to get better. And what can I do to help? In which ventured me to get to physical therapy, which actually ventured me into chiropractic. The ability to do everything in one house and control everything else. One of the big reasons why we started this and why I got into the practice and why we started the business as we did. For precautions that we take in the office, a variety of things. One, the biggest thing we do is we try to make sure we don't schedule multiple people at a time. So ideally, in a perfect world, when you're in the office, you're the only one in the office. Once you leave, at some point the next person will come in. We try not to overlap and not try to double book. Your time in the office is your time in the office. That way you can decrease your interaction with other individuals. We make sure we have air purifiers running in the rooms to take anything that's airborne in the air. We make sure we wipe down all the tables between the patients to make sure there is no cross-contamination of any kind. Not to mention beyond the masking that we wear as providers and patients wear as they come in the office, just to limit any exposure to anything in the office. We've done that for quite some time and have amplified it more so even with COVID. Favorite thing about that work that I enjoy is almost the instant gratification knowing you help somebody immediately, where they come in bent over, hunkered down, in pain, did something silly, twist and turn, whatever it's going to be, and they're out of here in 20 minutes. Just be able to stand upright, be able to move, not have to take that pill, to do what they can, know what they did before they got hurt, within the 1 or 2 visits that they come in here, without no drugs, without no surgery, anything else. And knowing you did that, and you helped them, and the look and the glow on their face when that happens, priceless. We here at Springtown pride ourselves to be able to make sure that when you walk in the door, it is not a quick adjust and you walk out the door. It is not a 2-second visit and you're out. Our goal is to sit here, sit down, you have the conversation, say exactly what's bothering you today, address all the parts, bodies, everything, irritations, so when you walk out the door, the whole body of you is better. And it's not a quick, quote unquote, wham, bam, thank you, in and out the door, next guy. It is, we sit here, we discuss what's going on, we evaluate everything, we treat everything. And we don't leave till you're satisfied and you're a lot better than when you walked in the door, regardless of the time it allows to take. There are many ways chiropractic can help with pregnancy. Biggest one, quite a few things. One being that when a woman is pregnant, in the course of pregnancy, they're very fearful to want to take any medications, any drugs, anything else they may hurt themselves and or the fetus. So when aches and pains do arise, they like to find a more natural, healthy method to deal with that, which is where we come into play. Biggest thing that happens when you go into pregnancy, the body expands, hips expand, pelvis expands, the back, everything, your whole posture changes. Your body also releases a hormone, relax, which makes all the ligaments loosey-goosey, allows your body and spine to slip in and out of position on a regular basis. Good thing about it is what we do is we make sure everything's aligned while that happens. You're supposed to expand, you're supposed to grow, you're carrying somebody else. It's supposed to be part of the process. But you want to make sure everything moves smoothly and evenly and quickly and it doesn't shift or twist or cause you pain or discomfort. Also important is toward the end of pregnancy, as you're getting close to the delivery date, you want to make sure your hips and sacrum are aligned. So when you do come down to push, you're pushing the baby down a slide. You don't have a sacrum tilted or a hip tilted where the baby's essentially hitting that. And you can't push it out and you're sitting there for 20, 30 minutes trying to push and nothing's happening. And that's the more likelihood of a C-section or something else coming into play because doctors are getting time rushed. Okay, cool. I give you your time to do it, but you can't push it out. Because essentially the baby's hitting the slide. The slide is not smooth because the hips or pelvis are twisted. We get in there, we shift it, we clear the pelvis, we make the hips, make sure everything's smooth. Come delivery time, it's quick and easy, pushing out, no problem, easy for the mom, easy for the baby.